So now I'm going to talk about pain management. Chronic debilitating pain, possibly one of the most common presentation in general practice, but also one of the most common reasons why people reach for cannabis. Statistics are really quite concerning, and it is actually quite a significant public health problem. It is estimated that about 20% of adult Australians suffer from some form of chronic pain. And the cost to Australian economy is really quite significant. Probably it costs us about $35 billion per year in lost time at work and also treatment costs. The most common reason for chronic pain is injury, but very interestingly, about 1/3 of patients are unable to identify the original cause, and the other problems would include chronic back pain, fibromyalgia, neuropathic pain, migraines, and so on. So, okay. The pain, chronic debilitating pain, as we know, affects these people on multiple levels: mental, emotional, physical, professional, social. Quite often these people are unable to work. They experience financial problems, they lose their jobs, they have to rely on Centrelink benefits to support themselves. But also the chronic debilitating pain, as we know, is associated with so many other comorbidities. They suffer from depression, anxiety, PTSD, insomnia, drug addiction, but also their sense of well-being and self-value is impaired as well. Quite often their relationships suffer, and they have to rely most of the time on the cocktail of heavy pharmaceutical agent, antidepressants, opioids, benzos, anticonvulsants, and anti-inflammatory. What we experience quite often that in spite of having so many medications, their pain is not 100% controlled. Quite often they come back to us and stating their pain level is about 7, 8, 9, 10. But on top of it, they are unable to function properly. They describe themselves that they feel like zombies, and their functionality is very largely affected. The simple things that we take for granted, even taking the children to the park, for them is something impossible to do. And very concerning, we are experiencing now global opioid epidemics. And I think it was created by medical profession. Opioids were actually never meant to be used for chronic pain. Opioids are very good in acute pain, but not so much when we use them for such a long time. And very alarmingly, this is RSGB data, that when we look at the whole population of the whole incidence of the overdose, about 80% of overdose are caused by pharmaceutical drug each year, and the most common being benzos and opioids. Now, the government decided to deal with the situation by introducing restriction in February. So patients have to come and see us to get the prescription for the over-the-counter medication. But just restricting something is not really going to solve the problem. We need to give them something that will actually help them. And just telling them, okay, now you need to go and meditate, although meditation, I believe, is very powerful, but just, change your thoughts, start meditating. These people don't have tools. If you are in so much pain, you are unable to process your emotion. So we need to give them something that will help them on many levels to reduce the pain, will help their functionality, improve general quality in life. And Australia is number 8 among the world's top opioid users. And states in America where cannabis has been legalized actually report the drop in opioid use and reduce hospital admission due to opioid problem. Now, so far, in my experience, like I said before, I'm noticing quite really encouraging result, and I can actually, demonstrate few stories how cannabis has helped these people already. For example, I have this patient with severe ulcerative colitis and chronic abdominal pain over the years. severe abdominal pain associated with very severe PR bleeding, bloatedness, and this man is in his early 30s. Even some occasional accidents of incontinence because of the bloatedness. So his life has been affected on many levels. So what happened? All the traditional treatments have failed, and around March, his gastroenterologist told him that the only option we have for you now is to go for colectomy and just leave 10 centimeters of your bowel. So he asked gastroenterologist, how about medicinal cannabis? He said, oh, it's not going to work. It's not really worth trying. So this patient decided to smoke some cannabis. He went to black market and started smoking. Within 2 weeks, his symptoms improved quite dramatically, but he was afraid to use black market product. So he approached me around the end of April. So what I did apply for medicinal cannabis, but I didn't ask for ulcerative colitis. My application was chronic debilitating pain secondary to ulcerative colitis. And that's how I got the approval for this patient. We got him the balanced cannabinoid formulation, the same THC and CBD 10 milligram to 1 mil. I was really very surprised. I couldn't believe that this is happening because I didn't expect it. But within 2 weeks, his bleeding has stopped. His bowel motion from about 10 to 20 came down to about 1 or 2 well-formed motion and no pain. Once again, I was really surprised by this result. So it's really quite rewarding and quite fascinating to be part of that. So why? But we also need to understand that according to guidelines, there is low to moderate amount of evidence that cannabis works. This is the official TGA guidelines. So we need to be cautious here. I'm not saying that this is the panacea for everything, but we are going to stop prescribing our traditional drugs. It's not going to happen. But I think that cannabis is going to enhance our therapeutic options. And I believe that we should take the best of different approaches. We can use modern medicine to our advantage, as well as cannabis and other therapeutic options, herbs and plants and so on. So currently, cannabis is not the first line treatment. We resort to cannabis if all the traditional treatments fail. It is a second line treatment. Now, as we can understand from my previous explanation about pharmacology and the action of THC and CBD, why cannabis can work in pain. Because cannabis can modulate the pain perception at the level, went too far. Can modulate by interacting CB1 receptors and CB2 receptors. It can modulate the pain perception at the level of peripheral nerves, spinal cord, and brain. Also, CBD interacts with TRPV1 receptors, so it can change the pain perception, affect inflammation. Also, CBD interacts agonistically with glycine receptors, and these receptors are involved in neuropathic pain and inflammation. So once again, cannabis is the second line of treatment. Now, palliative care, as we all know, the medical discipline which is dealing with symptom control for patients affected by serious, life-limiting, and incurable disease. However, as we know, not all palliative care patients are necessarily suffering from terminal disease where death is expected to happen in a relatively short period of time. For example, with multiple sclerosis patients with heart and lung disease, neurodegenerative, and so on. Now, what is the aim? So the aim of palliative care is to be involved in symptom control, improve quality of life, and also control the side effects of the medications that we are currently using, and provide the holistic care dealing with the multiple levels of chronic serious disease, which is mental, emotional, physical, and spiritual. Now, one of the common comments I hear from terminally ill patients, of a family that they want to feel like human beings till the end of their life. And quite often the medication that we use, especially opioids, impair their ability. They want to be able to take care of their affairs and function properly. So the currently used agents such as opioids, unfortunately, can cause sedation, dizziness, nausea, vomiting, constipation, physical dependence, tolerance, and respiratory depression. Now, these patients are unable to function, interact properly. Their motivation, concentration is reduced, and feel quite often very drowsy. So cannabis can work in a very complex way because it can alleviate the pain, it may improve depression, anxiety, may regulate nausea and vomiting. And also, I have 4 cancer patients, palliative care patients, that also alleviates that anguish, that fear of dying. They feel more accepting, they feel more relaxed about it. And a little bit of a euphoric effect, I think, is really quite appropriate in the situation. And I'm going to share quite an exciting story here. My cancer patient, David, is in his early 30s. Last year, he found a lump on the right side of his tongue. The biopsy showed that it was squamous cell carcinoma. After that, he went extensive surgery, which consisted of removal of the 3/4 of his tongue, his upper and lower teeth, and also the part of his jaw. That extensive surgery was followed up by radiotherapy. Unfortunately, cancer reoccurred around February, and he was told that this is it, nothing else could be done about it. He approached me for application for medicinal cannabis just to treat his pain, because his pain at the time was at a level of about 8, 9. He was using Endon, but he couldn't use high dose of that because he felt very drowsy and constipated. And his duragesic patches also were not controlling his symptom. So I managed to obtain cannabis for him, the balanced ratio of 10:10, THC and CBD. And the all was just about to be dispatched. And his oncologist said, no, we're going to try immunotherapy. But you're not allowed to use cannabis, because if we do, we are not going to go ahead with this treatment. So I said to him, you know, you have to follow the conventional medicine. And he went for that. He underwent immunotherapy, which was in May. Unfortunately, during immunotherapy, the growth on the right side of the neck, it grew very quickly. It was day by day, it was going bigger and bigger. Also was bleeding profusely, and he had this kind of very offensive, like a rotten meat smell. So at the end of May, the oncologist said, this is it, nothing else could be done about it. Now it's just palliation and pain relief. He came back, and then we organized the shipment of the plant, of the oil. We have few hiccups with the, because there was shortage in supply, but he started his treatment 15th of June with a small dose of 0.25 ml at night, and then we went quite quick and rather aggressively with the increasing dose. But we also decided that, I said to him, I'm not promising anything, this is rather experiential, but how about if we put some oil directly on your tumor? I was extremely surprised. What we are noticing now, the patient is still alive. But what I'm not saying that it's going to cure his cancer, but the bleeding has stopped completely within just a couple of days. The tumor stopped growing, and what is happening, which is really quite interesting, the middle part of the tumor is almost like flattening. It's like collapsing inside, like a crater. And the offensive smell is gone as well. Now his pain is well controlled. He feels quite relaxed and happy. And he said to me, if I didn't look in the mirror, if I didn't see the tumor, I wouldn't think that I have cancer. So it is very, how to say, inspiring to witness stories like that. I don't know what's going to happen to this patient, but I feel that I improve his quality of life, that he's not afraid of dying, even though it is happening most probably. He doesn't have so much pain. Now he's more motivated, he enjoys listening to music, and he goes out with his carrot, going to the beach and just doing normal things. So this is really quite rewarding. So once again, cannabis has this ability to interact with so many systems in the body and can provide multi-system relief for patients dealing with serious and terminal diseases. And I think the stories, especially stories like that, can demonstrate the point in the most powerful way. So what are the challenges that palliative care specialists and oncologists face these days? Because it is very difficult because there's few studies on cannabis on palliative care. The evidence is mostly anecdotal, which I personally don't like the word anecdotal. I would call it observational evidence, because to me, I'm not sure about you, but if millions of people around the world report some beneficial effect, are we going to ignore this evidence? Are we going to think that these people just imagine things? Just because it's observational doesn't mean that it's not true. Also, in palliative care, we worry about the possibility of cannabis interacting with other medication. And once again, in the current medical legal situation, we resort to cannabis if all the other traditional treatments fail. So the prescribing process, we know it's been a quite difficult, convoluted process. The CBD is scheduled as Schedule 4, so it only requires TGA approval. Formulation of THC and CBD require Schedule A and require both TGA and State Department approval. Now, in New South Wales, the single form was introduced, so we don't need to duplicate the process. We only communicate with TGA, so we fill in that form. We provide the patient's detail. We also need to put the designated chemist on that application. Patients can't go just to any chemist. They have to go to the particular one. I generally, before I send the application, I tend to call each chemist, the local chemist, and ask them, are you comfortable dispensing the cannabis medicine? Because some of them are not so sure about it. If they're not comfortable, then I tell them, look, this supplier of that particular product will contact you and explain this process. Once they understand it, they're quite happy to deal with that. And then I'm just going to talk, sorry, I'm a bit chaotic now, but I'll explain a little bit more. So we can go through normally we go through special access scheme A or B, but I'm choosing just B. And then we can also apply to become authorized prescriber. So once again, the process in New South Wales, single form, which goes to TGA. Now, we need to give them clinical justification. So I usually write the letter of clinical justification. After a few applications, you kind of develop your own template. So quite often you copy and paste things. In that letter of clinical justification, you need to provide the short history of the presenting symptom and other medical condition. You also need to provide the list of current medication and all the medication that were used trial and didn't work, and the reason that this medication was stopped, that they caused side effects. So you need to provide all of this application. Then you need to briefly describe how you're going to manage cannabis. So I usually write that it's going, the start low, go and slow approach will be used. I'm going to dose it this way. I will do, let's say if it doesn't work or side effects, I will stop it. I will monitor patients certain way and so on. And also I develop a template with the clinical evidence why this is going to work in that particular condition. Now, endorsement from specialists. So we kind of learned to know how to navigate with TGA. Initially, they kept on asking me, where is the endorsement for specialists? So I went back and I said, I'm the specialist in life. I am the GP. I know that I manage chronic pain management on a regular basis every day, and I feel comfortable and confident and comfortable that I can use the cannabis medicine. But I demonstrate my willingness to communicate with specialists. So I normally send them the letter notifying, sometimes I make phone calls. So even if I don't have a formal endorsement from specialists, all of my applications have been approved 100%. Sometimes TGA will come back to me with some questions. So I very politely answer why I'm doing this, and then they come back and approve me. One of the examples was approval for multiple sclerosis patient. So my reason, my application was chronic widespread neuropathic pain due to multiple sclerosis spasticity. So they came back and say, why don't you use Sativex? This is our registered product. So I went and said, it's too expensive. It costs $1,500 per month. And other formulations are cheaper, about $300, $400. So they came back and say, oh, financial reason is not the clinical justification. So I said, look, I didn't apply for multiple sclerosis. I applied for chronic debilitating pain. Patient just happens to suffer from MS, and that got approved. Now, okay, just I'm going to present a couple of case studies. So this is Neil, who is 72 years old. He came to me around May with a history of 20 years history of chronic debilitating pain due to rheumatoid arthritis. His other medical conditions include hyperlipidemia, glaucoma, and cataracts. By the way, glaucoma and cataracts were secondary to long-term use of steroids. Also osteopenia, and he had left total knee replacement. Now, this is the list of his medication, which didn't help him. Panadine 4 caused severe constipation and drowsiness, and the steroids cause ocular problem. So your initial consultation, I just quickly describe that. So the first thing when I see the patient asking for cannabis, I ask them, what is your expectation? What do you want to achieve? Because sometimes patients may come to us and hoping that we can shrink their brain tumors, which is not possible. So I am very clear of what I can do. I always say I'm not promising anything. This is unapproved product. So there's straight away clear communication. Also, the first question is, do you realize how expensive it is? Because the cost may be about $400 per month. Can you do this? And sometimes the consultation ends here, say, no, we can't afford it, so I'm not going to go ahead. And then the patient history. In patient history, what is important? We have to ask them about the history of the presenting symptom and the clinical diagnosis that for which medicinal cannabis is considered. We also need to ask about other medical conditions, such as cardiovascular disease, renal and liver disease. Past history, including mental disease, especially schizophrenia and bipolar. When we talk about family history, once again, especially mental disease, schizophrenia and bipolar. Any allergies, we have to ask about all the drugs taken in the past and side effects developed and reasons for cessation. And we need to ask about drug history, substance abuse, alcohol, and previous cannabis history, because we have different approach for cannabis in naive patients and different approach for patients who use cannabis already, because we know then how we're going to respond. We also need to ask about employment, driving, and operating heavy machinery. Patients also need to understand that just because they have product approved by the doctor, that doesn't mean that they are not going to be drug tested. It can happen, and they can be tested positive. And even though they are not impaired and they have the approval from the doctor, they can still, the police can take it further. So they are not completely protected on the road. Also, the living condition, like single parents, can they look after their children? The storage, making sure that this is out of reach of children, and so on. And we go for the possible adverse effects, and but also what's so very important to have that communication right from the beginning with the patient about patient responsibility. I'm telling them, you have to be able to communicate with me. You need to respond to my telephones and my emails. I encourage them to do the some daily diary about their symptoms. So when they are more involved in that, that kind of enhances all the success of the therapeutic consideration for cannabis. They also becoming more in tune with their body when they actually ask, you need to tell me the pain level every day. How is your sleep? How is your bowel motion or anything like that? So we need to get them to sign the consent form. They need to understand that this is unapproved product. And we do our general assessment, pain score and overall quality of life. So in case of Neil, his pain was averaging around 8 in spite of all of these medications. And then we applied for the cannabis product 1 to 20, which is 1 milligram of THC to 20 milligram of CBD per 1 ml. How do I choose my dosing? Okay, the general rules of dosing are such that large amount of CBD can be tolerated quite well, even 1,000 milligram per day. We are limited by the amount of THC. So the initial starting dose of THC in the product is between 1.25 to 2.5 milligram. And the maximum dose is up to 30 milligram per day. Obviously, if the benefits outweigh the risk in a special situation, especially terminally inpatient, we can go higher than 30 milligram of THC. So in case of a patient, we started him on 1 ml, and we just gently titrated to the optimal dose of 1.5. So he's taking 1.5 of that at night. Once again, I really didn't expect much, but the patient has improved a lot. His pain was reduced from 8 to 2, and quite often no periods of pain. Again, I'm noticing almost universally improved sleep and improved mood. He actually stopped his Panadine Forte. He didn't report adverse side effects, and now I see him once a month. But when I saw him last time, he actually started stopping his cortisone, his prednisone. So he stopped his morning dose. Now he's just on 1 milligram per day, and we're planning to reduce it and stop it gradually. But he's so much happier, and his wife is much happier as well, because before he was withdrawing from social contacts. Now they started going out, go to lunch. This all of these things that might be taken for granted for us who are healthy, for these people mean a lot. Now another patient, Marcin. He's Polish man on student visa, completely healthy until accident in October 2014. It was a motorbike accident. He was stationary at the red lights with his girlfriend, and he was hit by the car from behind. He was thrown out of the bike, him and his girlfriend. He sustained multiple soft tissue injury, thankfully no fractured bone, but he developed a chronic pain syndrome, PTSD, and his life basically became a nightmare. Was associated with sexual dysfunction, reduced libido, insomnia, nightmares, flashback, anxiety, depression, and an overall sense of guilt because he kept on thinking that he could have killed his girlfriend and it would be his fault. And the constant pain level, about 8, 9. Now here, the list of his medication, which as we can see, that was quite an extensive list and multiple side effects, which I needed to list on my letter of clinical justification. Once again, we went through the usual history, pain level about 9. So with Marcin, because he told me that he, at some stage last year, he tried tried cannabis from black market, some oil, and he responded very well. So I thought, with this young man, I'm going to go for 10 to 10. And when you use higher THC concentration, you can go for smaller volume, and that could be cost effective for patient as well. We started at 0.25, which equals to 2.5 milligram THC at night, no response. A few days later, about 4 or 5 days later, we went to 0.5, no response. And we eventually found that his optimal dose was 2 mils. So once again, his pain level, he's just so enthusiastic now. His life has changed. His pain level went from 9 to 8 to about 4 2, but recently he's saying so often that he just doesn't have pain yet at all. His appetite has improved. He was experiencing lots of gastrointestinal problems, reduced appetite. He sleeps better, his mood has improved, and what is also happening, his relationship has improved, his libido increased, so there's better relationship with his girlfriend. So overall improved quality of life, and I just basically see him every 4 to 6 weeks, but he sends me the email once a week just saying, I'm okay, I'm doing well, and the last email was, I just found a job. He feels more motivated, more focused, more, just in general feeling better. Once again, such a reward for a doctor to witness that. So I think this is the end of my presentation almost. What I like to encourage doctors here and doctors in general, I would like to create a network of doctors who are interested in using medicinal cannabis. So if whoever is interested, I would like you to reach out to me. This is my email, info@MediHuanna.com. I think it's very new to us. Quite often we may feel uncertain. Perhaps we are not sure what to do with this particular patient. So I would like you to reach out so we can help each other, support each other, and exchange all the relevant information. I think I really like to encourage and inspire GP to embrace cannabis as an important therapeutic agent. It's not the panacea for everything, but as we can see, it really can help a lot. And we need doctors who are willing to prescribe, because this way we can make cannabis more accessible and affordable for this patient who need it the most, because the one who need it most really can't afford it, and they need our support. And even if we are unable to prescribe, at least we can show the sympathetic ear. One of the patients who came in some time ago said to me, before I was able to prescribe, she said, "At least you don't treat me like a criminal, at least you listen to me." And I think it's very, very important that we embrace it. So to conclude, I would like to acknowledge Adam, Benjamin, and MediFarm to make this event possible. And also, not only that, I want to thank him and acknowledge him to work so tirelessly to bring the good quality medicinal grade medicinal products into Australia so we can help people. But also, I strongly believe in developing the network between ethical growers, manufacturers, doctors, pharmacists, so we support each other, we understand things better. We can start doing ongoing research. If doctors are allowed to prescribe, I strongly believe in an equal one study when we can follow each patient, collect data which you can send to universities, because cannabis has to be researched different way, not the same way as traditional synthetic single molecule agent. We need to open our minds to this new medicine. So once again, I wanted to thank everyone. I also want to acknowledge the managing director of MediHuanna, Paul Bulkevich, who was responsible for putting all of this accreditation together, working with the ICGB team and putting all the slides together. And once again, thank you very much, everyone, for putting up with me, listening to this presentation. Thank you so much. I feel very rewarded.